Hello everyone and welcome to this training session on Drug Master File or DMF. In this presentation, we will understand the purpose, structure, submission and life cycle management of Drug Master File. This training is especially useful for pharmaceutical professionals working in regulatory affairs, quality assurance, manufacturing and Drug Master File preparation. By the end of this presentation, you will have a practical understanding of what a drug master file is, why it is important, and how it supports pharmaceutical product organization. So let's begin with this first question. What is the purpose of drug master file? A drug master file is primarily used to provide confidential information to a regulatory authority. This confidential information may include details about the manufacturing process, raw material, process controls, specification, analytical methods, and stability of a pharmaceuticals material. The most important purpose of a drug master file is to protect proprietary and confidential information. For example, an API manufacturer may need to provide detailed manufacturing information to the regulatory authority. However, the manufacturer may not want to disclose this confidential information directly to the pharmaceutical applicant or marketing authorization holder. Therefore, the information can be submitted separately in a drug master file and reviewed confidentially by the regulatory authority. In a simple term, drug master file holder provides the confidential information, the regulatory authority reviews the information, and the drug master file support the applicant's pharmaceutical product registration. Now let's look at what information is typically included in an API DMF. An API drug master file generally contains detailed information about the identity, manufacturer, control, characterization, and stability of the API. Let's briefly understand the major section. First, we have general information, which include the identity and general description of API. Next is the manufacturing section. This is the most important section of the drug master file. It describes how the API is manufactured, including the manufacturing process and important process control. Then we have the control of the material section, which covers the starting material, reagents, solvent, and other material used during the manufacturing. The next important area is characterization. This section addresses the structure and property of API and may include information related to impurities. Then comes the control of drug substance, which include specification, analytical procedure, and supporting validation information. Finally, the DMF also include information related to the container closure system and last stability. Together, this section demonstrates how the API is manufactured, controlled, and maintained in a state of suitable for its intended pharmaceutical use. Now, drug submission and life cycle management. A very important concept to understand is that simply a one-time submission. A DMF is a living regulatory document. The life cycle typically begins with the initial submission of the drug master file. The regulatory authority may then review the drug master file in connection with a product applicants. to allow an applicant to refer the DMF. The DMF folder may provide a letter of authorization, commonly called as an LOA. After submission, change may occur in the pharmaceutical manufacturing process and its control, specification, analytical method, or other DMF information. Therefore, the DMF need the update through appropriate regulatory procedure. Normally, the key message is simple, that submit the correct information, maintain the information, update the information when required. Also remember that DMF requirement and terminology can differ between regulatory authority and region. Therefore, before preparing or updating a DMF, the applicable regulatory requirement should always be carefully reviewed. Now, key takeaways. Let's now summarize the key points from this training. A successfully DMF requires complete and scientifically justified documentation. The manufacturing process and quality control strategy should be clearly described and supported with the appropriate data. The DMFs should remain aligned with the applicable regulatory requirements and with the documentation submitted by pharmaceutical applicants. Effective change management is also essential. Whenever significant change occurs, the regulatory impact should be evaluated and the drug master file should be updated appropriately. Finally, regulatory queries should be answered clearly, scientifically, and within the required timeline. Now concluding, so remember these three key words: quality, consistency, compliances. These three principles form the foundation of effective DMF management. Thank you for watching this training session. If you found this presentation useful, please like, share, and subscribe for more pharmaceutical, regulatory, and drug master file training contents. Thank you for watching this training videos.